Good morning, ma'am. Today I will discuss the two kinds of methods of contraception. First, I will discuss the artificial methods. Oral contraceptives. The combined oral contraceptive pills is often just called the pill. It contains a official version of female hormones progesterone and progesterone, which are produced naturally in the ovaries. If sperm reaches an egg, pregnancy can happen. Advantage of oral contraceptives: it does not interrupt sex. It usually makes your bloods regular, lighter, and less painful. It reduces the risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS, premenstrual syndrome. And disadvantages of oral contraceptives. Some disadvantages of the pill include it can cause temporary side effects at first, such as headache, UC, breast tenderness, and mood swing. If, if they're not if they're not go after a few months, if many help to change to a different pill, it can increase your blood pressure. Next, transdermal patch. Transdermal patch adhere to the skin as way to deliver drugs. They provide a specific predetermined dose of medication that is absorbed through the skin and into the bloodstream. Advantage of transdermal patch. Transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interruption. Disadvantages: the patch is not a perfect means of contraception because of drawbacks listed below. It does not provide protection against sexually transmitted infection, STIs, including of HIV. Next, vaginal ring. The vaginal ring are polymeric drug delivery devices designed to provide controlled release of drug of intravaginal administration over extended periods of time. Advantages: it used correctly to the vaginal ring is more than 99% effective. One ring provided contraception for a month, so you don't have to think about it every day. You can continue to have sex. You can continue to have sex when the ring using is in place. Unlike the pill, the ring still works if you have sickness. Disadvantages: you may not feel comfortable inserting or removing it from your vagina. The side effect of such as increased vaginal discharge, headache, nausea, breast tenderness, and mood changes. Subdermal implants. A subdermal implants refer to a body modification that is placed underneath the skin, therefore allowing the body to heal over implant and creating a race design. Advantage: it include long-term contraceptive action without requiring the user of provider's attention. Law of highly effective contraception. Disadvantages: you may experience temporary side effect during the first few months, like headache, nausea, breast tenderness, and mood swing. Side effect: abdominal or back pain, an increased risk of non-cancerous ovarian cysts, change in vaginal bleeding of patterns, decreased sex drive, dizziness, headache, mild insulin resistance, mood swing, and depression. Male condoms. Condoms is a shape barriers device used during the sexual intercourse to reduce the probability of pregnancy or sexually transmitted infection. Advantage: reduce the risks of spreading sexually transmitted infection. Disadvantages: some couples find using condoms interrupt sex. Female condoms are a barrier method of contraception warm inside the vagina. Advantages: help to protect both partners from STIs, includes HIV. Disadvantages: some couples find that putting in a condom interrupts sex. Surgical methods. Surgical methods is an invasive technique with a fundamental principles of physical intervention on organs or organ system tissues for diagnostic or therapeutic reasons. Advantage: prevention of or improvements of medical condition caused by the patient's obesity. Disadvantages: it requires surgery usually under the general anesthetic. There is a risk, albeit low, of surgical complications such as internal bleeding, infection, or damage to other organs. Side effect. The side effect of surgical methods: pain, fatigue, appetite loss, problem of other parts of your body, swelling, drainage, infection, and bruising. That's all, ma'am. Thank you. And next, hormonal injection. Prevent pregnancy by injecting a synthetic version of the hormone progesterone called diphenhydrocyprogesterone acetate or DMPE. Advantages: its injection lasts for either 8 or 13 weeks. Doesn't not interrupt sex. It's an opinion. If you can't use abstain-based contraception, you do not have to remember to take a pill every day. Side effects can include weight gain, headache and mood swing, breast tenderness, and irregular bleeding. And next, intrauterine device. An intrauterine device, also known as intrauterine contraceptive device or coil, is a small often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. Advantages: it protects against pregnancy for 5 to 10 years depending on the year. Chemical barriers: destroy pathogens on the outer body surface at body openings and on inner body linings. Advantages: condoms protects against pregnancy. Barrier methods are safe to use while breastfeeding. Barrier methods do not use hormones. These methods do not affect a woman's menstrual cycle. Barrier methods cost less than hormonal types of birth control. Diaphragm. The diaphragm, located below to the lungs in the major muscles of is respiration advantage. You can need to use diaphragm or cup when you want to have sex. Disadvantage: it is not effective as other types of contraception, and this depends on you remembering to use it. Using incorrectly. Side effect from the spermicide, irritation on the vaginal and surrounding skin. Cerebral cup. The cerebral cup is a form of barriers contraception. Cerebral confettes over the cervix and blocks sperm from entering the uterus. Advantages: protects against pregnancy for 2 days or 48 hours, and for multiply acts in intercourse within that time frame. Disadvantages: it's more difficult for women to learn and insert remove than the diaphragm. Side effect from the spermicide: irritation of the vaginal and surrounding skin, or an allergic reaction, strong odors or vaginal discharge, an allergic reaction to the materials in the cup. This is rare. Changes in the cervix because of irritation. Next, I will discuss the natural methods. Abstinence. Abstinence is a self-enforced restraint from indulging in bodily activities that are widely experienced as giving pleasure. Advantages: abstinence can be a way to avoid the risks that come with sex, like pregnancy and STD. Disadvantages: there are few disadvantages to abstain. People may find it difficult to abstain for long periods of time. Side effect: anxiety and stress, memory, relationship, health, immune system, vaginal walls and lubrication, prostate cancer. Calendar methods. The calendar method based are various methods of estimating a woman likelihood fertility based on a record of the length of previous menstrual cycle. Advantages: calendar-based contraceptive methods prevent pregnancy by monitoring the fertile periods during the menstrual cycles. Disadvantages: the biggest drawback is that it's not effective of preventing pregnancy as other birth control methods. The side effect: it can be annoying to track your cycle every day. Basal body temperature. The basal body temperature is your temporary when you are fully at rest. Advantages: by helping you guide the best days to have or avoid unprotected sex. Cerebral muscles method. Fertility awareness methods may be used to avoid pregnancy or achieve pregnancy. Advantages: is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Some symptothermal method, a fertility awareness method used to predict when a woman might be fertile. Advantages: has a significant advantages in effectiveness because it combines the calendar, cerebral mucus and temperature methods. Side effect: mood changes, headache, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. Ovulation detection and the test defect are raised in utilizing hormone LH in the urine. Raised in this hormone signals the ovary to release the egg. Advantages: it helps determine the time in the menstrual cycle when getting pregnant is most likely. Interruptus is a traditional family planning methods in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before the ejaculates. Advantage: the pre-ejaculatory fluid that appears after the penis becomes erect. And that's all, ma'am. Thank you.